How keto diet can help reverse type 2 diabetes. Type 2 diabetes is normally defined as a chronic and progressive condition resulting from the insufficient production of natural insulin, causing high blood sugar in many patients. Upon receiving an official diagnosis, most patients are told they will need to take medication for life and that there is no cure for diabetes. However, many scientists, clinicians and dietitians disagree with this prognosis, claiming that diets such as the ketogenic keto diet have the potential to support the reversal of type 2 diabetes. What is diabetes? Diabetes is a disease where blood glucose levels remain elevated. Having high blood glucose levels can cause additional health problems over time, including cardiovascular disease, kidney disease, vision impairment, peripheral nerve damage and even depression. There are two main types of diabetes, type 1 and type 2. Type 2 is by far more common, accounting for 90% of all diabetes cases worldwide. In this type, the body does not make or does not use insulin well. It can happen to anyone but is more common in people over the age of 40, those who are overweight and inactive, those with a family history of diabetes and patients whose diets consist mainly of refined carbohydrates. What is the keto diet? The ketogenic diet, keto diet for short, is a high-fat, low-carb diet. The diet was originally developed in the 1920s as a treatment for epilepsy. However, it has since gained the attention of scientists and the public as a possible answer to a wide range of ailments, diabetes included. The keto diet involves restricting carbohydrates usually to less than 50 grams per day. The majority of a person's calories on this diet should come from fat, while protein intake should remain moderate. Eating in this manner puts the body in a natural metabolic state called ketosis, from which the diet got its name. When someone is in ketosis, they have high levels of acidic molecules called ketones in their blood and tissue. In ketosis, ketones function as fuel alternatives to glucose and can help diabetes patients who are unable to utilize glucose effectively. Clinician Today Shutterstock How Keto Diet Can Help Reverse Type 2 Diabetes Lifestyle Ketogenic Keto Diet Diabetes Ketosis versus ketoacidosis, what's the difference? Many diabetes patients are familiar with ketoacidosis, also called diabetic ketoacidosis, and they may confuse this condition with ketosis. Even medical experts often confuse these two terms, however they are not one and the same. Ketosis is a natural and healthy physiological reaction to a lack of carbohydrates in the diet. It is an evolutionary adaptation that has helped humans survive periods of food scarcity and starvation. There are well-documented health benefits of being in ketosis. Ketoacidosis, on the other hand, is a complication of poorly managed diabetes. It results in uncontrolled production of ketone bodies that can change the pH of the blood, which can prove fatal. Ketoacidosis is more common with type 1 diabetes rather than type 2. It's also important to note that the keto diet cannot cause ketoacidosis, but rather puts the body into the beneficial state of ketosis. Keto diet effects on blood glucose. While we know that the ketogenic diet induces ketosis and raises blood ketones, what do we know about its effects on blood glucose? After all, blood glucose is what all diabetes patients need to control. The ketogenic diet improves glucose levels mostly due to its nature as a low-carbohydrate diet. Click to tweet. However, there is more to the ketogenic diet for diabetes than that. Blood glucose is mainly derived from carbohydrates after all, and this relationship is confirmed by numerous randomized control studies. One such study involving 49 diabetes patients found that low-carb diets lead to greater improvements in fasting blood glucose, so much in fact that most of these patients were able to discontinue their prescribed diabetes medication. What about reversal of type 2 diabetes? Lifestyle and dietary modifications are commonly recommended to type 2 diabetes patients to help manage the disease. However, not many are promised complete disease reversal. Truth be told, complete reversal of type 2 diabetes is difficult, if not impossible. But the ketogenic diet can get your patients ever closer to this goal. According to Dr. Sarah Hallberg, an advocate of diabetes reversal with dietary intervention, low-carb diets are the only ones that can possibly reverse this disease. Most studies examining the possibility of diabetes reversal focus on general exercise and reducing calorie intake. Nonetheless, these studies found that lifestyle changes normalize beta cell functioning, meaning reversal is possible. Regarding keto diets specifically, studies have proven this method to be more effective than moderate protein diets in lowering blood glucose, promoting weight loss and lowering HbA1c in patients with type 2 diabetes. A growing number of clinicians now agree that low-carb diets can effectively treat this disease. The fact remains, these diets remain controversial and contradict dietary guidelines, so they are not very often discussed or recommended in the clinical setting. Conclusion: type 2 diabetes is a metabolic disorder resulting from many things, with the greatest risk factors being weight, lifestyle and dietary habits contributing to its onset. Since the disease typically starts with a sedentary lifestyle paired with a poor diet, it makes sense to approach treatment with lifestyle changes. One effective strategy is adopting a ketogenic diet, a diet that's proven to stabilize blood glucose and promote weight loss. While complete reversal of diabetes is difficult and rare, it still is possible with the help of low-carbohydrate diets and improved lifestyle choices. This is a proposition supported by a growing number of medical experts and research evidence. Unfortunately, we are yet to see the diet being recommended as a diabetes cure in doctors' offices. Do you recommend the keto diet to your diabetic patients? What other lifestyle changes do you think help reverse type 2 diabetes? Is reversal even possible? Tell us your thoughts in the comments below, or tweet us.